evening, Board President Gandara, Dr. Espinosa, boards of members of the board, I'm sorry. I'm before you to review the information that was presented on December 12th, last month. During our workshop, let me see if I can get the... Okay, so during the workshop, we came up with some plan design changes and then include some levers and some increases that we're hoping that through a multi-phase plan, a 3-year plan, will allow us to decrease our deficit. The deficit that we're looking at is a 4.5%. So let me just briefly review the levers with you so you can briefly be reminded of what we were looking at. When it comes to the health plan, what we're looking is do an engagement when it comes to better inform our employees in terms of what they have available, whether it's through a primary care visit office, through mail order, encourage them to establish those relationships with their primary care physicians, better utilization of the specialties or visits with healthcare providers who specialize in certain categories. What we're proposing is to initiate the plan changes as of July 1st. Those plan design changes include an increase of the premium, and as you can see on our slide, what we have is phase 1, which shows the individual let me see, I'm sorry, I lost my train of thought. Where we show our initial or our current premium. We have the employee only, which is a current premium of $60 that will be increased to $80 and so on and so forth. What we're only doing is increasing $20 across the board. Then down below, we have the actual health plan design. What is it that we're proposing on the plan side of things? We're seeing that we're proposing an increase on the individual deductible from $200 to $300, and a family deductible, an increase of $400 to $600. The out-of-pocket maximum, it goes from $1,500 to $2,000, and the primary care or office visits for primary care and specialists have also an increase of $5 for primary care, and for specialists, $10. The prescriptions at this point, when it comes to the co-payments themselves, there is no increase, though we are proposing the introduction of 2 pharmacy programs. The first one is the step therapy program that will coordinate the availability of prescriptions to our employees, meaning if there's a generic available to the employee for that particular form of prescription, then the generic will be made available. If a brand is required, then it will require certification from a healthcare provider to be able to provide that brand prescription to the member. Then we have the value drug list, which would allow for us to be able to cover some over-the-counter presentations or medications that are again already available over the counter, such as those for anti-acid, allergies, and so on and so forth. So what does this mean? What does it translate to? It's my understanding that in prior meetings, we were looking through the information that we received from Mr. Reza and making an increase to where it would allow for us to recoup that 4.9 deficit in a one-time change per se. We would do one implementation and would allow for us, hopefully, to bring that deficit down to 0. Well, what we're doing through the multi-phase plan is gradually make those changes or those increments to where we are recouping 1.3 per plan year versus having to increase our premiums, let's say from $20 all the way to $80. Right now, what we would look at if you were someone who was considered employee only under the base plan, you're paying 0. The premium itself or the cost for on a monthly basis for an employee only is $550, which is being contributed in its total amount by the school district. Well, what we're requesting is that instead of making that available to the employee, and again, under coverage employee only, instead of $0 to be now $20. I don't know if at this point the board or the members have any questions on the information that we had reviewed back in December 12th. But before I get to the next item, which is we'll answer some of the questions that were posed during that session, I'd like to share some information that was received as feedback during our last Benefits Committee meeting. Soon after the workshop, I used the same information. Mr. Reza also used the same information to do a presentation to, again, our Benefit Committee members. And quite frankly, it was somewhat enlightening to see that our employees, even though it was a reduced number of employees, they're not oblivious to the situation. They don't necessarily ignore the fact that there's the need for change. And surprisingly, they were very, I'm not saying they were up in arms and, chanting and happy about this, but they were cognizant of the fact that, there has to be a change. So as I requested feedback from them, some of them proposed for us to increase, let's say, the co-pay for generic. If my topic or the conversation that I was having at that point is we're trying to encourage people to use generics versus a non-preferred. A person said, well, why don't you just leave the generics like $0 and increase the prescription co-payment for those non-brand? And I explained to the group that our intent is to make sure that we do our research and try to impact or have less impact as a group, as a whole, rather than perhaps making someone feel that just because I have an illness, I'm the one who has to have pay that cost. That's not the intent. We're trying to see how is it that as a group we can pull through and, make sure that we meet those medical expenses to include prescriptions. Excuse me. In addition to that, there was a couple of employees that, of course, voiced their opinion in terms of, well, this to me means that you're reducing my pay. And, I explained to the group that it could be a perception either way. Yet, at the end of the day, we do have a great benefit plan packet. We do have great compensation. And because of our current situation as a group, based on our cost, our expenses, what we're experiencing as a group, we need to make some changes. The changes could happen now, this year, but eventually they will happen if we don't make those changes this year. And again, I think that's important because it was good to hear some feedback from the Benefits Committee and to know that, they're aware that changes are coming. Like I said, it's not that they were up in arms and clapping and saying hooray, but they know that it's not, they don't ignore the current situation. I'm supposed to cue, there we go. In addition, during that workshop we held, I believe it was Mr. Nájera, if I recall correctly, and perhaps Mr. Ayub also, who mentioned or inquired about what we're doing as a group in terms of wellness and how this relates to the effort that we're making in terms of reducing cost or possibly controlling the cost. And what you have on the slide is just to show you, or an illustration of what we have done so far, because this is, to my knowledge, a new initiative, a new program that has been implemented as of this current year with this particular group. So you have the number of participants per type of event. We had a men's health fair held back in June, up to the Maintain, Don't Gain Challenge, what was held between the months of October and December. And, again, it was gratifying to see that even though there is a small number compared to the overall population there's a small number of participants, there is participation. People are becoming aware of what we're trying to accomplish as a group. A activity that's coming up, and we're anticipating to have it or start having the activity as of March, is an activity known as Know Your Numbers. And what it entails is a screening, a basic screening where our blood pressure, weight, BMI, and so on is measured, is calculated, and then we will receive a report. And we're hoping that by us being aware of that, those numbers will make some decisions in terms of perhaps the line of care that we need to seek. Then we're going a step further to where we, the providers, are actually visiting a campus and setting up at the campus to where it'll be a little bit easier for the employee to access the screening. Every so often we hear back that, well, the reason why I haven't done my physical this year is because I need to take time off from work. Earlier today, it was approved through administration to allow employees to schedule their screenings throughout the day and be able to attend, whatever the site is, and be able to take care of that screening. I think that taking steps like this will allow us to be a little bit more cognizant as a group, as an employee, as an individual, of what I need to do to better aid our current deficit when it comes to the money that we're spending on medical expenses and prescriptions and so on. So that's another wellness activity that was recently approved, and I think it's a good thing, it's important, and our employees are willing to participate, as I mentioned. The wellness screening will reward participants with a $25 gift certificate. We have a wellness fund available, and for those that complete the wellness through our carrier's website, in this case Cigna, once they complete the whole process, they'll be able to claim their gift certificate for $25. And there's an extensive list of providers or vendors available, so they'll have an array of opportunity in terms of how would they like to reward themselves as well. In addition to that, I was asked to provide information in terms of what we're doing in terms of partnership with other vendors and how we're promoting those partnerships with our employees. And I believe I mentioned that during orientation, we do provide a copy of the information that you see before you, but we are, as suggested, going to visit our campuses during open enrollment. Again, provide them with a copy of what you see, the information you see before you. Again, just to be able to promote through different venues, wellness. In addition to this, we are also looking into other activities, because we know that perhaps I may not be the type that attends the gym per se, and there might be other activities that I might like to, take care of. Physical activities such as CrossFit or cycling or spinning, what have you. There's plenty of activities to do out there, and we're hoping that we'll be able to establish those as well, with perks such as not having to sign up an agreement. As you can see in this case with Gold's Gym, be able to take care of, on a monthly basis for $9.99, take care of 2 of our dependents. Sometimes our employees don't have a physical activity because of the fact that they don't have daycare, or daycare is too expensive, or I don't have anyone to take care of my kids. Well, we were able to provide this through Gold's Gym as well, and so on and so forth. In addition to wellness, I was requested to bring a comparison, a benchmark analysis or report in terms of how do we compare as an employer to other regions, and when it comes to the same type of workforce that we have. And there is 3 reports. It might be 1 report for you, but there's 3 PDFs or 3 reports that separate a comparison of cost and contribution for administration, education, and transportation. On any of the 3 reports, you'll be able to see that when it comes to what it's being contributed on behalf of the school district, in comparison to what other employers are contributing, in addition to what the employee is contributing actually in Socorro, and again, what they're contributing with their, depending on the industry they're in, we are, as employees, we have a better advantage in terms of what we need to out of pocket as premiums. In addition to that, through the report, you'll be able to see that there is no report for custodial services. And it was reported to us that for custodial services or ancillary departments, typically the industry doesn't offer a health plan. What they offer is a preventive type of plan where only preventive care is made available to the employee, and from time to time it's only made available at a discount rate. It's not necessarily your coverage. So again, for those two particular groups that we were considering during another meeting where we were looking at the impact that they might have, transportation and custodians, when compared to the Southwest region or on a national level, they have a great benefits packet with Socorro ISD, again, because at other interstates, sometimes they don't even have the privilege of being able to sign up into a medical plan. The comparison, the benchmark is the first page. You'll see that it has the highlights of our plan, and then the second page, it compares it to the plan that it's being offered for the specific employment group. Again, there's three. There's administration, education, and transportation. There's not one for custodial services that had been requested. In addition to that, it was asked for me to bring and I believe I don't see Mr. Reza yet, but I know he's running late. He'll be joining us as well. But just to provide you some information in terms of the cost, currently comparing our cost to what we looked at, how we analyze the data is we look at a base period versus a current period. And the period is 12 months. In this case, what we're looking at is October through September. So in comparison to 12 months, it's made through October 2014 to September 2015, and then October 2015 to September 2016. And we look at those 12 months side by side to see how is it that we're doing. How are we spending our monies? How are we spending our funds? When it comes to cost, last year, looking at that period I mentioned, between October 2014 and September 2015, our cost was $46,731,000. Our current cost, that same period I just mentioned, October 2015, September 2016, our cost is $51,241,000. You don't have those numbers in front of you, but I do have the information available if you need to review it. This leads to the trend that we talked about during, again, our last workshop, an increase of about 9% of increase in cost. We're looking at the same cost increase in prescriptions. The employer paid $9,538,000, and our current expenses are $10,597,000, an increase of 11%. So all this, the numbers translate to we're spending our money faster than what we're contributing back into the plan. Based on the information that I had covered so far, I don't know if any of you have any questions.
Any questions?
At this point, and I know we're waiting on Mr. Reza, on your proposal, 3-year phase-in plan, and what the district could potentially also put in on behalf of the employee, would that cover our cost at least for the coming years, 1 or 2 years?
No. What we're looking at is decrease our deficit, reduce our deficit at least by 1.3 million. Our deficit is 4.5, So we're hoping that we'll decrease it gradually, 1.3% every plan year.
But will that happen if the cost is continuing to go up? We're gonna have to cut the cost too.
Right. It'll be, that's a good question. I can't tell you a certain yes or a no because there's many factors that will play a role here. Depending on the number of catastrophic cases that we have, depending on the number, I'm hoping that by implementing, let's say, the value list for drugs, where people, instead of purchasing an anti-acid formula at the pharmacy, it's purchased at the over-the-counter level, that will help us reduce those expenses that we have in prescriptions. We'll implement the change. We'll try to encourage people to follow those trends. That will, I'm hoping, will help us to come down to 1.3, 2.6, 9.6. But I can't guarantee that will be the case because I can't anticipate the behavior of the group. We can only implement changes to where we can steer them to, encourage them to become better consumers, but I can't tell you that will be the case. Will it, technically speaking, looking at the numbers, the numbers show that we will reduce within three years, we'll reduce our deficit from 4.5 to 0. But there's no guarantee that will be the case. Perhaps our deficit at that point may not be 4.5. It could possibly be $1 million, it could be $500,000, or we could be on the opposite. Absolutely. I'm hopeful that by the wellness initiatives, us going out there, educating our population, that the changes may not necessarily follow that same trend we're proposing, but I think that at this point, based on our experience as a group, based on that deficit, this will be an educated number, an educated decision.
Mr. Rondera, I've got a question.
Ms. Rodriguez.
Forgive me, and I just wanted to follow up on what Mr. Ayub said. So this proposal and the reduction of deficit, is this right here for medical? We're looking at $3.2 million, and in prescriptions, $1.2 million, give or take. And I'm sorry, again, is that after phase 3? If phase 3 takes into effect, this is what we're looking at?
That is correct, ma'am, yes.
Okay. So we're still looking at a deficit?
Correct. So going back to, if I may, to a comment that was made during the Benefits Committee meeting, someone mentioned, why don't you just increase the deductible for the people who are on the premium option? Well, then I mentioned to the group, remember, we're the numbers, our data, we're looking at everyone as a group. We're trying to, everyone, they do their part. We're not trying to target a specific group and then for them to feel that because perhaps they're the ones that are consuming more or receiving more medical treatment are the ones who have to pay for the remainder of the group. I mean, we just don't know when we're going to need our health insurance.
That's right.
Someone
Exactly.
mentioned, yes.
Gotta tell you, you just never know.
Right.
Just tends to sneak up on you.
Mr. Gonzalez.
Yeah, how many insurance companies are available to Socorro District?
For the health plan, we're self-funded. So technically speaking, we are our own health insurance because we design our own benefits. We establish our own district contribution, the rate that the employee will have to pay and so on. So technically speaking, we are our own insurance company. We partner up with a third-party administrator, a TPA, in this case, Cigna, to where they will reach into our bucket of money and will pay our medical expenses. The advantage here is that we don't have to have the expenses of administration when it comes to processing claims and so on. We get rebates from prescriptions and so on and so forth. So again, we're our own health insurance. That's why it's so important that we look at the numbers and try to.
I understand that, but I guess my question is, how many of those administrator companies are available to the district?
Right now, we have business with Cigna. How many are available to us?
Right.
There's an array of companies, just to mention a few in no particular order. There's Aetna, United, Blue Cross, in this case Cigna, and so on and so forth. But our benefits are being currently administered through Cigna.
So we can pick any company across state lines.
Yes, sir. That's the beauty of being self-funded, that we have that freedom.
Thank you.
You're welcome, sir.
Any more questions?
I do.
Mr. Nakana?
Mr. Carmona, for clarity, we have to issue an RFP, and we did, and we chose with Cigna, correct?
Correct.
How long is our commitment to Cigna?
If I'm not mistaken, our first renewal is up this year.
Okay, so have we, I mean, it's January, and is our renewal in June or is it in December?
June.
Okay, so that's 6 months. That's a short
Wow.
time. If you're, just by my thinking, if we haven't started now, we're kind of behind the ball.
Well, I'm hoping that since I've gone through RFPs before through renewals, that I'll be able to time it to where we'll be okay. But you have a good point, yes. That could possibly be the case.
Okay, and so if we RFP, then Mr. Gonzalez is correct. At that point, we have the ability to select from anybody, but right now our commitment is to Cigna, correct?
Correct, yes. And
And I think we have options too.
Right, for
I think we still have options.
Okay,
We could just roll over.
right, okay.
though, regardless of the TPA that we were, let's say that in this case, instead of having business with Cigna, it was Blue Cross, Blue Shield, or Aetna, and so on. I think in general, what we're experiencing as a group, what we're expending as a group, what we're consuming as a group, don't necessarily change us. Perhaps we might have different discounts, better, not that good, perhaps great, but as a group, as Socorro ISD, I don't think the numbers will change because, again, we're self-funded. So when it comes to the medical plan itself, it's mainly us. We will need to make that decision. Do we want to continue covering 90-10, 80-20? Do we want to change that?
Mr. Aaron? So if the cost of doing business drops, theoretically, this would be beneficial to us, right? And we would not see as much.
Possibly. Now, what we're contributing into the health fund and what we're expending from the health fund is not necessarily what we're paying to Cigna. Cigna charges an administrative fee per member per month. That's why I was saying that regardless of who we're doing business with, there is an administrative fee per member per month. So there might be a savings, perhaps just to give you, a scenario, not necessarily that this is the amount they're charging, but let's say that a company A is charging us right now $2, and then company C comes by and says, well, they're charging you $2, I'll charge you $1.98. There might potentially be a savings for us, but that doesn't translate to a savings when it comes to a health plan, because our health plan continues to be 90-10, 80-20, co-payments continue to be the same, prescription co-payments continue to be the same, and so on.
So unless hospitals or doctors or treatments cost less, that's not going to change.
Correct. And the trends show that healthcare, all the way across the board, it's increasing year after year.
So provided that nothing changes, you'd be correct. But if things do change, those prices can go down, right?
There is a possibility, yes.
Thank you.
That is just so rare. I mean, wishful thinking, Mr. Gonzalez.
Yes, it is.
Any more questions?
That was just that wishful thinking about 6 months.
Any other questions? I'm sorry.
There's no more questions.
No? Okay. Thank you, everyone.
Thank you.
Thank you.
The cost and so forth, were you going to do that or we're waiting on Mr. Reza for that?
Oh, I'm sorry. Yes, Mr. Reza.
Okay.
hear you. Mike, can you speak to the mic? Oh, sorry.
One of the presentations that Mr. Reza provided, I don't know if it was at a committee or one of the budget priorities, was to increase the employer contribution by $25, which would give us another $1.5 million. But what we discussed at the last board meeting is to do it in 3 years so that the employee won't be hit too hard with a big increase. But we can do whatever the board decides to do. We can try to bring you all back some other numbers.
Put that on the board real quick, right?
Well, Mr. Gandra? Well, one of the things I wanted to discuss, certainly with staff and with the board, is that we did have this proposal from staff regarding that maybe next year we would raise the contribution to the employees across the board by $20 or $25, and then the year after that, they had a 3-year plan. And so my thought is this: when I'm looking at, I don't know, it's about page 3 or 4, where we have the current district and employee contribution comparison between Socorro, Clint, El Paso, and Isleta. You know, there's always the concern about the $7, $8 an hour employee, and how is that going to impact them? Because right now, let's be honest, if we have a $7 or $8 employee that he's only insuring himself, or we have a $100,000 employee, I don't know how many of those we have, that's only insuring themselves, the insurance is free. And so there's no impact on that whatsoever, at least at the base plan. So employee 0, and when you compare it to Clint, an employee there on the very minimum is $304, El Paso is $179, and Isleta's $211. So at the end of the day, our $8 an hour, $7 an hour employee here, yeah, they're going to see $20 less a month in their paycheck, but these poor guys that are comparable to them in these other districts are seeing these much larger deficits in their check. So I don't think we're really hurting employees. And my thought, and I think some of you all may have the same thought, everybody's aware that healthcare is going up, that health cost is going up. I don't think, I agree with Mr. Carmona. The employees are not oblivious to this. Certainly those of us that have families and we pay money, you know, even in co-pays or whatever we need to pay, we know the cost is going up. I think the employees would be more supportive if we do a plan similar to what Mr. Reza has said, where we go up in small amounts, because one of the budget priorities we've gotten already is administration is going to recommend that we kick in another $1.5 million next year, add $25 from our perspective to try to make ends meet here. And so I really think we're all in the same boat. The employees, I think, do understand, and I really think that a plan that they propose, I know at HR, we've talked about this now for about 3-4 meetings and peripherally on other things. Mr. Gonzalez's comment is well taken, and one of the ways to reduce the cost of doing business potentially would be our clinic. But again, we're not going to force people to go there, so people that want to go there would save us some money, people that don't. So that's still way in the distance. But I think rather than we're going to kick this in the middle of a board meeting, I really kind of wanted to discuss that because I think that the plan the administration is putting forward is good. I know we're going to get some upset employees, a few of them, and I would hope that if they look at this chart and they look at the cost of doing business, that they realize that these things do cost money and the cost is going up, but still when you compare it, it's still very minimal. I worried about the total out-of-pocket thing, but typically those things, you usually don't have to write a check for that. They're going to bill you for that amount in subsequent times, and hopefully won't put our employees in a bind. So that's kind of what I was hoping also Mr. Reza was going to cover, because I think we need to be informed and kind of give some thought to that.
See, and I'm sorry, Mr. Gandra, and I was hoping also that we'd get an overall budget impact of what it's going to look like, and, you know, is this, you know, I agree with Mr. Ayub. I think the idea of, instead of what one of the districts did a couple of years ago, from 0 to 60 in, you know, a couple of seconds, incremental is, of course, you know, a lot easier on the employees, but I would have liked to have gotten more information as far as like what impact is going to be on the budget. Again, if we're going to be asked next year to look at increasing, you know, the budget for this, you know, how are we going to be able to offset, or are we going to be able to offset? And again, knowing that catastrophic events are catastrophic events. We cannot predict that whatsoever. I'm living proof of that, obviously, but are we going to have enough money in the budget to be able to offset all the costs that we need to? And is this the best possible option?
Well,
Real quick, I'm sorry, I apologize real quick. I gotta excuse myself. Mr. Guerra's gonna take over the meeting.
Okay. So, Mr. Guerra, agreeing with you, Ms. Rodriguez, the other thing that I think we need to be aware of, that we've talked a little bit in finance, and maybe Mr. Nájera would want to chime in on this, is that including this year, there's probably going to be a request by administration for us to add money to the healthcare plan in order to keep things correct with our employees, which, again, we want to protect our employees. Don't get me wrong. This is a prime concern to me, to make sure our employees are well taken care of. And quite frankly, folks, I think we may have to do that for a couple of years until this number gets to zero at that point. Now, I'm an optimist. These things can fluctuate and trend up and down, and we may save money, and things may get better. And kind of trying to encourage employees to maybe do things that will help us better with funding will help. But there is a cost here based on what I agree with Ms. Rodriguez's comment that we've talked a little bit in finance. And I think everybody needs to, I hope everybody understands that the school district, and I think I'm just one board member, as the board is concerned from my perspective, we want to pitch in as much as we can, but we're all in the same boat. And when you look at the comparison charts here, we're way under. We've been very fortunate we've been able to afford that for our employees. I don't want to do like that other district did a couple of years ago when we raised it by $130 a month. That's ludicrous. But I think $20, $25 would be reasonable, and over time, folks will adjust. And I realize a gallon of milk and a gallon of gas go up, but I think in order to keep them safe, we need to consider that.
I too was hoping, and I understand that Mr. Dessa can't be here, but I too was hoping to see what the impact of the increase in the contributions would be. I know last time I asked, and I didn't bring it with me, probably, my fault for not bringing it with me, but the number of employees in each one of the different plans, to consider the impact. One of the things that sits in the back of my mind, and these are, it's funny, Mr. Carmona, right? I used to work as an analyst. It's a financial analyst, and doing things like this, and it just constantly seeing that the more information I provided, the more questions it created, and here I am feeling kind of guilty because, I'm thinking I'm giving work to somebody else because I used to sit in that role, and you try and anticipate every question that you're going to get, and you just can't.
But questions are always good. So.
But as I look at these, national comparisons, I think they're meaningful and they're helpful. But the one thing that to me is missing is these contributions. I mean, is it wage adjusted? If we're looking at national comparisons and I see that the contribution for national levels compared to us, we're at 2,000 and nationally they're at 10,000. Well, but if our average salary is 30,000 and in New York it's 80,000, that's not a good comparison. So that's the question that comes to my mind. When I look at the other district as well, I was hoping somebody, and thank you, somebody found it for me, what the poverty level is for a single individual, because if you think one person, an employee, who is working for us and right now gets no premium on a monthly basis, and we take $20, well, the one thing that came to my mind is, okay, the lowest from the comparable districts is $179, and if you take that dollar amount, multiply it by 12 and add it to the poverty level, maybe that person at $179 a month falls below the poverty level, so they're getting public assistance, whereas our employee, we're taking money from them, and I doubt that they would qualify. So we're taking, $240, and that $240 is gone It's not coming through public assistance. It's not coming from anywhere else. Whereas, and I did the calculation would be $6.75 an hour. I don't know how many employees are at $6.75 an hour. You know, I don't know if we have anybody that, well, no, because the minimum wages. Yeah. That's what happens when you think, you know, stream of consciousness. I should.
Showing your age.
Right. Now, really showing my age, what was I even saying? But at any rate, you know, those are the kind of things that come to my mind. You know, does $20 from our lowest paid employee have a more significant impact than the $175 from comparable districts because of the other programs that then become available to them that are not going to be available? And I know it sounds counterintuitive, but I mean, if that's the case, you know, increase it more because the help is better, you know? And that's not what I'm suggesting.
With the new administration, we don't know what's going to happen.
Yeah, I know. But you know, you follow my logic. If we're just going to take away,
Yes.
okay, well then let's take away enough so that other avenues of assistance become available and it's made up somewhere else, you know? I know that's not what we want to do. That's not what we want to do. But, you know, how do we prevent those situations? And, you know, I don't have the information and that would allow me to know, you know, that the impacts to someone aren't that adverse, that the consequences aren't that bad.
Right.
You know what I mean? Okay.
Mr. Kubota,
Yes, sir.
it is obvious that our contribution has been excellent. But I guess the only question I have, well, not really concerned, but by raising $20, and then next portion, next year, 25 and 30, well, the copay is gonna go up also, so is the deductible. And that's
Let me
the
go back
concern
to-
I'm about, because we're not only looking at $15, now it's gonna be $20, and it's gonna go up $30. Deductible's gonna triple the amount from $500 the first year to, I believe, $1,500 in 3 years. I believe I saw on the base plan.
So on the base plan, let me see, I think,
So, I mean, I understand we have to raise the contribution, but now the copay, don't forget, the copay is gonna take effect too. It's another $5 added.
right,
Every time you go to the doctor, then the deductible also as well.
Correct.
So it's not just $20 that's it's gonna affect. the
correct.
individual.
So, yes, you're absolutely right. So I'm sorry, I lost your question there for a minute, but you're right. So if there's someone who's not actively participating in the plan, what they would see is only an increment of $20 when it comes to their paycheck. They will only have to pay $20 and so on and so forth. But if we have someone who's actively incurring medical expenses, what they would see is not only the $20 increment, but possibly if, let's say they're on the base plan, their deductible will increase as well. So as a result, they will need to make further arrangements with their healthcare provider to be able to meet that deductible. Yes.
Mr. Guerra. And I can say, in some of the discussion we've had before, the issue was this, that the increase of the $20 contribution from the employee, here's what we have to pay in order to have a standing health plan, so that it's there all the time. And we would have to raise it more if we don't impact the co-pays. But the second way that we could impact this is people pay when you need it. And so if people pay when you need it, that is the co-pays, and then we only increase then the contribution from the employee smaller, then that's two ways to fund this thing. If you don't want to raise the co-pays, then we got to raise the minimum, the contribution higher, because then that's we're gonna have to absorb the full cost of having a standing health plan. And by doing it both ways, you kind of address both sides. All of us pitch in to keep a health plan in place. And then those that do need it, well, then they have to pay another $5 to use it in order to keep it solvent. And so it's two sides of the equation there. Is my understanding,
Right,
am I
you're correct. And the intent is that as we go through each phase, again, we reduce that 4.9% deficit. Every phase, we reduce it by 1.3. So that's what it's allowing us to be able to do that multi-phase.
Now, I didn't see Mr. Corona, but phase 2 and 3, are we gonna continue to bump up the co-pays and so forth, or this was a one-time thing?
For phase 1, this is actually what we're proposing. There is a change also for phase 2 and phase 3, yes. Anticipating that we remain within that deficit, that percentage, that 4.9. Yes.
But like if our health clinic brings more revenue, then phase two may be adjusted as well. Now, one thing that I do want to comment, Mr. Nahara, you mentioned that our contract with Cigna ends in June. So I just confirmed it ends June of 2018, and then we have 2 one-year extensions. So we're good in that part.
Thank you. Sorry about that.
Do we have a catastrophic insurance?
Yes, we have stop
Reinsurance?
loss. Yes.
Where is it and how much?
It's not here, but we can provide that information if we need it.
And do we have not a participation amongst the employees?
Right now, the information that we get back, or the last year-end review that we did, we looked at about 20 cases that hit a mark to where we need to look at the numbers that are, those chronic illnesses or cancer, your heart surgeries, your newborns that have an illness or complication, right? We do look at those cases as well, but since we do have stop loss insurance, we offset the expense as well.
Mr. Compaya, when were you hoping to take this to the board?
February.
Well, we have open enrollment in April, so it takes us like a month and a half in our department to set up all the tables, and we were hoping to take it in February to not miss open enrollment, but we can do what the board desires to do. I think the last time we also discussed, do we want to change the employee contribution, and maybe the base plan will not increase at all, and then the premier plan would increase significantly. Those are options as well. But anything we do, it's going to impact some of our employees.
Well, I think I'm okay with the February thing because give us a little time. I'd rather, some of the questions we have that we may not be able to get answered, I'd rather hash that out before we get to a board meeting.
Yes.
So sometime between now and the February board meeting, I'd like to get that
By
information.
next?
We can go to the committee meetings at the beginning of February as well, just in case there's any questions. Or we can have another board, I just hate to bring you all back for another board workshop.
The committees.
Or, and this is pretty important. I'm not opposed to a workshop, if that's what it takes, then that's what it takes. Mr. Guerra?
I think the workshop probably be better.
Okay. And that way I'll make sure Mr. Reza is present at that board workshop.
And I'm sorry, Mr. Guerra. Mr. Campoya, also, since we are talking about having another board workshop, would it be possible, and I think it was mentioned earlier this evening, to find out how many employees we have at each of the
Plans?
of the plans?
Yes, ma'am,
I think
definitely.
that would help us as well in looking at
Yes.
a big picture of the district and who is utilizing the different plans.
Yes, definitely. And the other thing I was asking Mr. Carmona is, on one of the slides, it shows the total amount that we would be saving after phase 3, so he'll also bring savings per phase. So phase 1, it'll show you savings as well.
Any other questions?
Mr. Guerra? Mr. Carmona, no, I forgot my question. Oh, for the stop loss. I think, I don't think the number of instances is important as the rate. Because, if we've got a consistent rate and I really don't think the stop loss is important because I think over a population like ours, it's going to be, comparable to anybody else, especially with the variety of employees that we have when we think about the spectrum of them, age, distribution probably between the different sexes, roles, what they do across our district. I think we pretty much run the spectrum, so I think it'll be comparable anywhere, and I think the numbers account for it, so I don't think we're going to have much variation there. But I think in addition to the numbers, I think if we can somehow find the number per plan, the distribution of those employees, and I don't know if we do it by pay family, kind of like you did with the comparison between administrative, transportation, and education. I think that would be meaningful as well.
Okay.
So just for clarification, Mr. Nahara, by pay family, meaning teachers would be one pay family, administration, paraprofessional, technology, and auxiliary.
Yeah. I think, what I'm trying to isolate, Mr. Campoya, is, I think that's fine. I'm trying to. Is that a comparative group? I mean, you probably know more than any.
It's
Who's an
similar-
auxiliary?
Yeah, it's
Is it
similar to
transportation.
transportation, custodians, your maintenance employees, that is auxiliary. Paraprofessional is all your clerical.
Yeah. So okay. Yeah. All right. Because what I'm trying to avoid is getting a category where we have someone making minimum wage and then someone making $1 billion as well, and then lumping them in the same category, because that's not very informative. So trying to make sure that the distribution between top and bottom within the particular category that we're looking is fairly
Yes.
close.
And just for clarification, none of our employees that are on our health plan are at the minimum wage. The minimum wage is $8.80 for those employees.
Okay.
So, I'm sorry, Mr. Guerrero. So 1.5 raise next year will cover the cost.
1.5 for the lowest paid employee will cover the cost at $20.
Any other questions? Mr. Carmona, thank you. Mr. Campoya, thank you so much.
Thank you, everyone.
So we'll check with with Claudia on your schedules for the next board workshop.
No further questions? Workshop's over. Time is 6:26. Thank you.
Yeah, because I think we have to, unless they're part-time.
Because it was mentioned during HR the other night, something about some employees not being covered in their health insurance.
But is that by their choice? They would sign up because it's a zero, they're not paying.
They're not paying.
So I don't know.
Because you said there was one